of the teams looked at how we use our space for patient and physician interactions. And there was a lot of observational research and looking at the exam room, all of the equipment that's in the exam room, and then through observations with designers sitting there, how do we use that space? And it was very evident that not all interactions between patients and physicians require the table, the sink, the scopes, all of the equipment that comes in that room. And so there was some effort to roughly prototype through using foam core construction, different room designs, how we might utilize our space differently. We built out in our shell space foam core construction of what we call the consult room, where it's more designed around when a physical exam is not necessarily part of that interaction, but it is more just a dialogue between a patient and a physician. So the foam core construction consisted of basically a computer screen, a table, desks, or chairs around there where the family could gather. The physician was there. So we built that out. We invited physicians in, clinical assistants, nurses came through, they actually brought patients through that space as well to see what how people would respond to that kind of environment or that setting. And from that, then they took one of the rooms here in our lab and recreated that in actual using real equipment. And it's been wildly successful. It's one of the rooms that when our physicians are doing their summary visits with patients, we've changed the lighting, so it's softer lighting. Rather than the tile floor, it's carpet, it's a table, they sit around the table, those sorts of things.
Historically, patients receive information, and while we try to communicate it in a way that we hope patients understand, we also understand that a lot of the information that's given during a visit sort of gets lost. Maybe one, if we're lucky, two major concepts come out, and as an internist, I'm trying to balance a lot of different issues. One of the prototypes and pilots that we've pursued over the last year and a half has been sort of a visit worksheet that can be given to the patient before they leave, and so. I describe it as talking items, main concepts, major results. They're actually given to the patient before they leave. That way, when the patient's in the room, when the patient's out of the room, they can look at the sheet and maybe jog their memory about some of the major topics. As an internist, there are a lot of issues that I have to balance, and I'm trying to synthesize information from various consultants and multiple labs, and I know that's hard for patients to remember that. It's hard for me to remember that, and so this tool or this process of providing the information at the time the patient leaves has been helpful for the patients. They like it, and it's been helpful for me. It helps me organize my thoughts about sort of a complex visit.